how to read and understand your angiography report like a pro. Hello everyone, I am Dr. Toishi Sharma, Interventional Cardiologist. Today we will talk about angiography. If you or your loved one has had an angiography, you probably received a report full of numbers and medical terms. Today, we will explain how to understand it step by step so that you can read the report like a pro. Let's start with what an angiography shows. An angiography is an X-ray test with dye that shows the coronary arteries, the blood vessels that supply your heart. The report usually mentions three things: which artery is affected, like LAD, RCA, or circumflex. Number 2, it shows the percentage of narrowing or blockage. Number 3, it shows whether the blood flow is normal or reduced. Now, let's understand the arteries first. There are 4 main arteries that you will see on the report. The first is left main artery. And this artery is the main artery that divides into 2 arteries. The LAD, which is also called the left anterior descending artery. Sometimes people refer to the LAD as the widowmaker artery because it supplies a large portion of the heart. The circumflex, which is the second branch from the left main artery, usually supplies the left side of the heart and the back of the heart. The RCA, or the right coronary artery, supplies the right side of the heart and the bottom of the heart. It can also sometimes supply the conduction system or the electrical system inside your heart. Now, for example, if your report says LAD 50% stenosis, it means the LAD artery is narrowed by half. Now let's understand the percentage of blockages. Here's how to interpret the numbers. If it says less than 50% blockage, this is a mild blockage which is usually treated with medications like aspirin, statin, and lifestyle changes, which include diet changes and exercise regimen. If it mentions 50 to 70% blockage, this is a moderate blockage. And decision depends on the symptoms, the presentation, and the doctor may do special tests like FFR or DFR, which measure the blood flow and help us to decide whether this moderate blockage should be treated like a mild blockage just with medications, or should this moderate blockage be treated like a severe blockage with stents or surgery. And the third option may be a more than 70% blockage. Generally, a 80 to 90% blockage is considered severe, and depending on your symptoms and the location, it may need a stent or bypass surgery, especially if you have had a heart attack. If you have a severe blockage, which is more than 70%, and you've had a heart attack, or the blockage is in the proximal part of the LAD, or the blockage is in the left main, then you may need a stent or surgery. But many times the severe blockage can be in a small artery or a small branch of the artery, and it can still be treated safely with medications alone, as long as the medications are controlling your symptoms and you have not had a heart attack. So remember that it is not just the percentage, but whether the blockage is causing symptoms, is causing ischemia, and exact location of the blockage that will determine what needs to be done for the blockage. And finally, you may also see terms like diffuse disease, which basically means that there are long segments of narrowing in that particular artery. You may see a word like calcification, and this means that there is hard calcium deposit in the artery wall. You may also see a word like TIMI flow, TIMI. So this is an assessment of how well the blood is flowing through the artery. TIMI 3 flow is normal and TIMI 0 flow means there is complete blockage. Lastly, you can also see something like collateral circulation. What this is actually if there is a blockage in one of the blood vessels, the collateral blood vessels are natural bypass vessels that have developed by your own body to compensate for a blockage. So friends, these particular details put together help your cardiologist to decide the best treatment plan for you. So, your angiography report tells you where the blockage is, how much the narrowing is, and how it affects your blood flow. A 40% blockage is not the same as an 80% blockage. And it is important to remember that in two different patients with the same blockage may need different treatments, depending on the symptoms and their risk factors. Always discuss your report with your cardiologist, but now you will be able to read it with confidence. I'm Dr. Toishi Sharma. If this video helped you, please like, share this video, and subscribe for more heart health education. See you next time.